All right. Thank you, thank you. So we'll try to get through as much as we can today. Want to say thank you for allowing me the opportunity to speak with everybody. Just a show of hands, anybody here 5, 7 years out of college? All right, excellent, I like that. And the reason, we have a lot of students, okay, well that's good, because I'm going to be relying heavily on you guys during this talk to shout out some answers and help me as we kind of go through this. But just to let you know a little bit about myself and what we're doing at Capital Regional. Essentially, I moved to Tallahassee in about 12 years ago from the University of Florida. Any Gators? No Gators? All right. Well, I root for the Seminoles now, so I changed. So I'm a Seminole fan. With that being said, I'm board certified in psychiatry and also did additional training in addiction medicine. Addiction medicine has always been an interest of mine since residency. Started working initially at Tallahassee Memorial Hospital, where our team opened an inpatient facility where we did detox, and then also worked in an intensive outpatient program. And fortunately, now able to work at Capital Regional Center. We're starting to implement some of those programs in the upcoming future. And in fact, good news, at the end of this month, we're actually going to be starting an substance abuse intensive outpatient program at Capital Regional Medical Center. So we're just going to get started with that. It's going to be a program Monday through Thursday from 4 to 7. So that's going to allow a lot of people to go after work, and will help them kind of through their journey into recovery. And hopefully at the end I'll have a little bit of time so we can have some questions and answers based on the talk. So without further ado, I wanted to show you the brain of the average adolescent, the average college student. And what's interesting about this, hopefully the laser pointer will get to it. Basically, it shows that there's a lot of impulse in the adolescent and adult brain, young adult brain, compared to the adult brain. And this is supposed to be a little bit of a comic, but it actually points to a lot of the emotions that are going through the adolescent and young adult brain. You can see high levels of, let me see, maybe I'll step over here. Emotions such as love, well, maybe that's not gonna work. Anyways, addiction, love, hate parents, a lot of very intense emotions in that corner. But if you look at the top, that little heart section, that's the judgment gland. This is not meant to be an actual brain, but you can see that judgment is one of the smallest areas. And the reason behind that is actually scientifically based. For example, we'll learn throughout the talk that the prefrontal cortex is not fully developed until people are in their mid-20s. And the prefrontal cortex is an area of the brain which is involved in judgment, impulse control, and also kind of regulating our ability to assess long-term consequences for behavior. So what makes the college student population unique? Several different developmental considerations. I don't know if they've been talked previously, but first one being identity exploration. This is a time where you have young adults, maybe for the first time, being independent, having the ability to choose, their work careers, their school careers, relationships, not only peer relationships, but romantic relationships. And all these things can cause anxiety. And as people have more and more anxiety, they may look into different ways to regulate that anxiety. And sometimes that can involve alcohol or other substances, which we'll be talking about today. Instability, significant amount of instability. Maybe the first time people are leaving home, living with independently with friends, peers, possibly living in a dorm setting, and also even throughout people's college experiences, moving to different places. People may change their career goals throughout their college experience. So it's a very stressful time, not only from a school-related perspective and a housing-related perspective, but also from a peer relationship and romantic relationship perspective as well. Self-focus. This is an area where we kind of leave the nest, so to speak, and we get a greater sense of independence. That independence, we no longer have our parents being the driving force, typically telling us what's right and wrong. We may look at our peers or older peers to give us that direction, and it may not always be the best advice. feeling in between. Am I a young adult? Am I an adolescent? And am I an adult at this point? College students are certainly struggling with that dynamic as well. And then also possibilities. This is an interesting theory that a lot of college students have an unrealistic expectation and optimism. So this can prohibit them from actually seeing the negative consequences of their behavior. Kind of the idea of being bulletproof in some ways, that these consequences really won't happen to me. It always happens to somebody else or somebody who's a lot older potentially. So neurodevelopmental factors, I talked about this a little bit earlier, and this is very important. The frontal lobe is not fully developed into our mid-20s. So that's typically why we, if you look at any of the major insurance carriers in the country, you're not really able to rent a car, I don't think, until you're about 25. And the reason is, it's not because they decided 25 is a good number, it's because the number of accidents that occur significantly are reduced after 25. And that's because we have a frontal lobe that's fully developed. During adolescence, you can see that the midbrain structures and impulsive symptoms are actually fully developed. So we have basically the ability to drive a car really fast, impulse control center, but we don't have the brake to tell us when we need to slow down. Talked about the prefrontal cortex and its function. And this is also something that we'll see a little bit later in the talk, which is important. Some research indicates that engaging in substance abuse in adolescence, not necessarily young adult, but even in adolescence, strengthens pleasure and reward-seeking centers in the brain. So we're going to talk just a little bit about that, where those are located, and maybe I've talked about it, sounds like, in other presentations. But basically, this is a sagittal view of the brain, which is depicting the prefrontal cortex, which you can kind of see in the anterior area there, and the nucleus accumbens in the ventral tegmental area. The ventral tegmental area is an area in the midbrain that goes to the nucleus accumbens, and that's thought to be our pleasure pathway or our addiction circuit in the brain. The prefrontal cortex also sends afferent and efferent neurons to the pleasure center to help regulate that impulse control center. So you can see if your prefrontal cortex isn't telling your addiction center what to do, because it isn't fully developed, you can have some consequences as a result. So specifically, some of the college student consequences, just in regards to alcohol use, not with other substances. 60% of college student report past month drinking. The college students that are within 5 to 7 years, would you agree with that? All right, sounds reasonable. What about a third of college students report heavy episodic drinking in the past 2 weeks? Might be a little low, might be a little high. The interesting thing about heavy episodic drinking in this paper, it wasn't binge drinking. Binge drinking is defined as having 5 drinks for men in a 2-hour period, or 4 drinks for women in a 2-hour period. Heavy episodic drinking is actually 1.5 to 2 times that. So 10 drinks or 8 drinks, respectively, for a third of college students within a 2-week period. Over 600,000 physical assaults, 97,000 sexual assaults, over about 600,000 unintentional injuries, and 1,800 deaths annually because of alcohol. And then also 21% of college student drinkers report unplanned sexual behavior, and 10% report unprotected sex, which increases the risk for STDs and pregnancy. Academic performance, this is a pretty easy slide. Alcohol use and binge drinking has been associated with poor performance. 25% of college students report academic consequences. And heavy alcohol use has been shown to directly impact the chances of dropping out of college, working in less prestigious jobs, and experiencing alcohol dependence 10 years later. Let's just kind of take it back to the slide before, where we talk about some research indicates that engaging in substance abuse, it's the last one there, in adolescence actually strengthens the addiction pathway. Well, we're seeing that play out in those adolescents and young adults who binge drink 10 years later have a much higher incidence of alcohol dependence. So you can think of drinking in adolescence as a young adult as priming that addiction pathway, which may lead to alcohol dependence in the future. Alcohol blackouts. This is a fairly significant consequence of heavy alcohol use. It's defined as a period of amnesia where the person is able to engage in activity. However, the brain is not able to create memories for the events. During blackouts, people can engage in mundane activities or even emotionally charged events, violence, sexual intercourse. Had the ability to work in several different prisons, and I've talked to several inmates who are serving long sentences for things that they don't remember doing. So alcohol intoxication is not a defense in the criminal justice system. It's very unfortunate when you find somebody who's serving a 15-year sentence at the age of 22 who said, yeah, I woke up in the morning, I was in the police station and didn't know what I did, but I heard from friends and from the police. Interesting thing about blackouts is it's different than passing out. Passing out is you fall asleep. Blackouts, you're able to hold information in short-term memory long enough to actually have detailed conversations. And why is this important? Going back to the slide, or the last bullet point, given the nature of the preservation of short-term memory, it can be difficult or impossible to tell when a drinker is actually experiencing a blackout. So you may be talking to a friend, you may be talking to somebody that's had too much to drink, but you don't necessarily know that their memory has been affected, and they're actually going to wake up the next morning with either a fragmentary or an en bloc blackout. The difference between the two is fragmentary, you wake up the next morning and you say, I can remember bits and pieces. I think I remember talking to that person. I don't remember what happened on the way home. And then the en bloc blackout is whenever you wake up in the morning and you have no idea where you are and no idea how you got there. And usually friends have to kind of fill you in on what happened. And that's just because alcohol inhibits the consolidation of memory from short-term into the long-term memory. I don't know if anybody's ever seen this movie before, possibly. Well, it's a movie that basically the whole premise is based on a blackout. These three individuals are going away on a bachelor party, and the next thing you know, they've had a little bit too much of substances, Rohypnol, mixing it with alcohol, and don't remember what they did the whole night before. So if anybody's trying to research blackouts, that might be a good movie if you have a sense of humor. If you don't have a sense of humor, don't watch it. Alcohol overdoses, large quantities of alcohol. So this is kind of as you proceed down the line from a blackout. It can suppress the brainstem nuclei, which are involved in breathing, and the gag reflex. A lot of people that actually die from alcohol intoxication vomit, and they're not able to clear their trachea, and because their gag reflex is impacted. Symptoms of alcohol poisoning include vomiting, slow and irregular breathing, hypothermia, mental confusion, stupor, and death. And not too recent of a study, but from 1999 to 2008, there was a 25% increase among 18 to 24-year-olds in regards to alcohol overdoses. This last bullet point is something that I see on a regular basis. Unfortunately, the average BAL for overdose death from alcohol is 0.33%. So that's about 4 times the legal limit. So significant amount of alcohol in a short period of time versus alcohol combined with other prescription drugs. You just have to be over the legal limit, essentially, if you mix alcohol with a prescription drug. And the most common prescription drugs are opiates and benzodiazepines. And the reason being is that the opiates and benzodiazepines combined with alcohol don't have a summative effect. 1 + 1 doesn't equal 2. 1 + 1 = 3 or 4. It's a synergistic effect with that combination of drugs. And if you've been on college campuses, it's not uncommon for it to be much easier for people to get prescription drugs like OxyContin, oxycodone, and Xanax than it can even be more difficult to get alcohol these days. Sexual assault. 82% of students who experienced unwanted sexual intercourse were intoxicated at the time. 6% of college students reporting being raped while incapacitated by alcohol. And what increases the risk factors? Alcohol contributes to risk by impairing perception that one is in danger, and also the ability to effectively respond to sexual aggression. Also, there's a misperception of friendly gestures as interest, potentially in sexual activity, leading to sexual aggression. And this is typically primarily in men who become sexually aggressive and can misinterpret and have severe consequences as a result. So just to show of hands, guy on the left, we may know, and person on the right is supposed to depict college versus non-college comparisons. So Belushi's somebody who went to college, and the other person is somebody who went directly into the workforce out of high school. How many people think that college students drink more than non-college students? All right, so about 30%. Oh, we got college students. Okay, non-college comparisons. How many people think that people that skip college and go right into the workforce drink more? All right. I may have asked that the wrong way, but long story short, the answer is actually non-college people drink less. And the thought is because there's this in-between stage that occurs whenever you're in college. You know, like I said, it's kind of you're suspended in time and suspended in responsibility, whereas people that are going directly into the workforce have more protective factors in that they may have to have jobs. Their peer group may be a lot older and more mature. They may be functioning with other people that have a fully formed prefrontal cortex. You know, they may be in their 30s or 40s, 50s. And they may also have responsibilities such as a spouse or children. So college actually is a risk factor for drinking. That was surprising to me. So what high-risk drinking behavior? To this, I'm going to lean on the recent grads. Anybody know what pregaming is? All right, what's pregaming? So one person just screaming out, it doesn't matter. Four Locos, yeah, exactly. Yeah, so pregaming. Well, why do people, anybody know why people pregame? What's the thought about that? It's cheaper, right? So before you want to go to an event that may cost a lot of money or not have alcohol there, you get together with a group of friends and you drink a significant amount of alcohol to try to carry you throughout the night because you may not be able to afford the alcohol at the event, or it may not be there. So this causes rapid rates of intoxication. These are all risk factors for alcohol issues, and it's associated with higher rates of alcohol-related consequences, all the things we've been talking about. Neglecting responsibilities, feeling sick, passing out, missing school, drunk driving, alcohol poisoning, violent acts, blackouts. And then also drinking games. Anybody name a drinking game? Flip cup, beer pong, I heard. Yes, you can actually watch beer pong on ESPN. You know, it's really in our culture now that they have the International Beer Pong Association, and then I remember watching beer pong and bags is another game that people, cornhole, yes. Depends where you, yeah, if you're from the north, sometimes we call it bags. Yes. Oh, I have 5 minutes. All right. So I say all that to say is if you can reduce drinking games and pre-gaming, you have a much higher chance of reducing, obviously, binge eating and binge drinking. Binge eating is another behavioral addiction we could talk about too. Living situations, there's a lot of reasons that we can rationalize drinking, especially in college. I mean, think about the academic week. How many people didn't like to take classes on Friday? You know, there's obviously the possibility of that in college. Not many people can not work on Friday whenever they get to their job. Academic year, you know, the first 2 weeks of school, it's a great time because everybody's getting together. Really, the professors haven't given us much homework yet. There's not exams until midterm, so, well, maybe we just go out and celebrate every day. That also is followed by holidays and breaks, you know, after midterms, after finals, winter break where you meet up with all your friends from high school, and also in the summer where you may have less responsibility if you're not working. Also, 21st birthday's highest rate of alcohol intoxication in anybody's life, and campus events, particularly college football. You know, those have a very high incidence of alcohol intoxication, alcohol poisoning. Protective behavioral strategies, I think you guys had talked about this a little bit earlier, but one thing, if you look at Europe versus the United States, in Europe, adolescents and young adults are socialized to drink at a much younger age, so it's not a rite of passage necessarily to go to college and experience your first time where you have open access to alcohol. That's thought to be protective in some of those countries where people are learning to drink responsibility, potentially around other adults, whereas the first time some of our students at Florida State University had a drink, they were being coached on how to drink by their peers, which can be very dangerous because people can not really assess what normal drinking behavior is at that stage in their life. I'm going to keep skipping through because I have a very short amount of time. But if you look at a coronal view of the brain, you can see the gray matter and the white matter. Essentially, alcohol and binge drinking reduces gray matter volume as well as white matter volume. The difference between the two is gray matter volume is cell bodies and dendrites, and the white matter are the axons. So it affects not only the cell body, but it affects the transmission of all different types of cognitive processes throughout the brain. And what are we trying to avoid? This is another, I think, a better depiction. This is an MRI. It's a coronal view of the brain. And I don't know if you can make it out, but you can see fairly significant reduction in gray matter as well as white matter volume, enlarged ventricles. Basically, the brain's pickled. That's what when people say pickled brain, well, that's the alcoholic brain of a 43-year-old. So all of the things that we've talked about today not only are risk factors, but consequences to the changes in brain anatomy and also behavior as people move on through their life. Open up for any questions. I know I might be out of time, but